What is Mpox? Mpox is a disease caused by a virus. It's related to smallpox, but usually milder. Scientists first found Mpox in monkeys, hence the name. In humans, it causes flu-like symptoms and a rash. The first human case was in 1970. Since then, outbreaks have happened, mostly in Central and West Africa. Recently, cases have appeared in other parts of the world. Mpox is a serious public health concern. We need to understand how it spreads and how to protect ourselves. The good news is that we have tools to combat this virus. Recognizing the symptoms. Mpox symptoms usually appear 1 to 2 weeks after infection. This period is known as the incubation period, where the virus is present but not yet causing noticeable symptoms. Sometimes it takes up to 3 weeks for symptoms to manifest. This variability can make it challenging to pinpoint the exact time of infection. The first signs are often like the flu, making it easy to confuse with other common illnesses. You might have a fever, feel tired, or have muscle aches. These symptoms can be mild or severe, depending on the individual's immune response. A few days later, a rash develops. This rash is a key indicator of Mpox and should not be ignored. It starts as flat, red spots, then turns into blisters. These blisters can be quite painful and are a clear sign of the infection progressing. These blisters contain the virus and are highly contagious. It's crucial to avoid contact with others to prevent spreading the infection. The rash can be itchy and painful. Scratching can lead to secondary infections, so it's important to keep the area clean and avoid irritation. Other possible symptoms include headache, swollen lymph nodes, and chills. These symptoms can vary in intensity and duration. Not everyone experiences all symptoms. The presentation can differ greatly from person to person, making it essential to monitor any unusual changes in your health. If you have any concerns, see a doctor immediately. Early consultation can help in managing the symptoms effectively. Early diagnosis and treatment are crucial. Timely medical intervention can significantly improve outcomes and prevent complications. Mpox transmission, how it spreads. Mpox spreads through close contact with an infected person or animal. This includes touching the rash, blisters, or bodily fluids. Contact with contaminated materials like bedding can also spread the virus. While less common, transmission through respiratory droplets is possible. This usually requires prolonged face-to-face contact. Pregnant women can transmit the virus to their fetus. It's important to note that Mpox is not as easily spread as some other viruses. Casual contact, like walking past someone, is unlikely to transmit the virus. However, understanding transmission routes is key to prevention. While most people recover from Mpox without complications, it can be dangerous. Complications can arise, particularly in individuals with weakened immune systems. These can include secondary infections, pneumonia, and even death. Pregnant women are at increased risk of severe illness. Infection during pregnancy can lead to complications like miscarriage or stillbirth. Newborns infected with Mpox can develop serious health issues. The psychological impact of Mpox should not be underestimated. The visible rash can cause stigma and discrimination. This highlights the need for empathy and accurate information to combat misinformation. The recent Mpox outbreak has affected many countries, spreading rapidly across continents and causing widespread concern among health officials and the general public. The World Health Organization declared it a public health emergency of international concern, emphasizing the urgent need for international cooperation and swift action to contain the outbreak. This highlights the seriousness of the situation and the need for a coordinated global response, involving governments, health organizations, and communities working together to mitigate the impact. While the overall case fatality rate is low, it's higher in certain groups, particularly among those with compromised immune systems or pre-existing health conditions. Access to healthcare and underlying health conditions play a significant role in disease severity, highlighting the disparities between different regions and populations. Understanding these statistics helps policymakers implement effective control measures, ensuring resources are allocated where they are needed most and interventions are tailored to specific needs. Data collection and analysis are ongoing, providing crucial insights into the spread and impact of the virus, which inform public health decisions. Scientists are working tirelessly to understand the virus better, its transmission patterns, and the effectiveness of vaccines and treatments, aiming to develop more effective prevention and treatment strategies. This information is crucial for developing public health strategies, ensuring that interventions are based on the latest scientific evidence and are as effective as possible in controlling the outbreak. The good news is that we can take steps to protect ourselves and others from Mpox. By being proactive, we can significantly reduce the risk of infection and spread. Vaccination is a key tool in preventing the spread. It not only protects the individual but also helps in building community immunity. Vaccines are available and effective in preventing infection. They have been rigorously tested and are safe for use. Practicing good hygiene is essential. Simple actions like washing hands can make a big difference. Wash your hands regularly with soap and water, especially after contact with someone who might be infected. This simple habit can prevent the spread of many infections. Avoid close contact with sick people and their belongings. Staying informed is crucial. Disinfecting commonly touched objects can also help. Reliable sources like the World Health Organization and the CDC provide up-to-date information on the outbreak. Regularly checking these sources ensures you have the latest guidelines. Awareness empowers us to make informed decisions and protect ourselves and our communities. By staying educated, we can all contribute to a healthier society.